So if you just go into the general population when they're talking about migraine triggers, it is a different meaning than what I'm going to talk about. But I want to also cover triggers a little bit for those who are new members and want to understand where the trigger image comes in the picture. Okay, so there are triggers according to the public. There are migraine triggers, and these would be like, say, for example, chocolate, MSG, banana, coffee, cheese, and there's just a lot of foods that people will eat, and they say, well, it triggered a migraine, and so therefore it's a food trigger. But what actually happens is that none of these foods trigger the migraine. They have some ingredients in them that can cause an electrolyte imbalance. So now we have to come to the cause of migraine and what actually it is. But the migraine brain is so different that it is actually a carbohydrate intolerant brain. So when you eat carbohydrates, the electrolyte is changed by carbohydrates. So the way carbohydrates are metabolized in the body, first of all, the carbohydrates have to be taken out of the food. And we just talked about this before we started this meeting, that when you drink the fruit juice, for example, it's a huge load of sugar as opposed to eating the fruit, for example, with the fiber in it, where you don't open up all the fiber cells and you get less sugar. But what sugar does, we're not considering how it works in the body. So we just think that we take the fruit or sugar, whatever, and we swallow it and it goes into the blood and that's it. But actually, no, it goes into the blood, and from the blood, then it has to go into the cell, but it can't go into the cell. Sugar is a very large molecule, and cells are very tiny. And a sugar molecule also contains a lot of water within it. And so when the sugar molecule enters the cell, it has to be taken into the cell by a transport system. And so there are two transporters. One is insulin. Very few organs use insulin, by the way, for sugar transport, but the other is sodium. Sodium is 40% of salt. Salt is sodium and chloride. And so in order for glucose to enter the cell, it needs an energy created by the sodium leaving that cell. And so when glucose enters the cell, it has to remove sodium, and with that also water from the cell. So when you eat carbohydrates, then you're basically losing salt from your body because it's going to be going into just urinated out. And the sodium in the brain is the one that actually runs the brain. So if the sodium left the cell and the cell area where the sodium could be used, and you don't have enough sodium at particular sodium channels where the brain has to activate its electricity, it generates its own electricity, it's an organic electricity. If it isn't there, then basically your nerve cell, your brain cell, the neuron can't function, and your brain shuts down at that particular place. And so the migraine is the physical message of the brain not functioning. It's the brain trying to fix itself, and it's unable to fix itself. So it is sending a pain signal, stop everything, I can't work. And so it isn't particularly the MSG or the sugar or the banana or the chocolate, but in all these foods, there are elements that can cause an electrolyte imbalance. For example, if you look at MSG, what is MSG? It's monosodium glutamate. So when you're looking at what monosodium glutamate, three separate words, mono meaning one, sodium meaning the sodium that I just talked about, and glutamate is an amino acid, right? So if I'm looking at salt, we need salt in the body, and we need sodium to enter the cell. Here you're eating sodium without the chloride. And so you're causing an imbalance between a sodium and a chloride. The chloride is a negatively charged ion staying outside of the cell, and the sodium is a positively one coming and going in and out of the cell to generate the electricity. If you're just having monosodium, be it with glutamate or anything else, it's going to cause an electrolyte imbalance. There is your migraine. If you're talking about banana or chocolate, banana and chocolate both are rich in potassium. Well, there is a potassium to sodium ratio in every cell. And when sodium enters the cell to generate electricity, potassium leaves. These two are both positively charged, and they repel each other. So as much sodium as goes into the cell, that's how much potassium has to come out of the cell. If you're eating too much potassium or eating potassium without sodium, you're causing an electrolyte imbalance. And so there's your problem. If you're eating cheese, cheese is a trigger, so-called, but it's a trigger because it's very high in sodium. It has no potassium or very minimal. So again, you're eating a lot of salt, but then you're not eating potassium to go with it, and you're causing an electrolyte imbalance. So every single food that has any connection to causing a migraine is causing it because it causes an electrolyte imbalance. And so when you're talking about the nutritionist general, then you have to set up groups of foods, not just single food like MSG or banana or cheese, but groups of foods, and say, okay, this group of food is going to cause an electrolyte imbalance because, and most of the foods cause electrolyte imbalance because of the carbohydrates in them. And so when we're looking at nutrients, the first thing that we need to consider is how much carbohydrate is in the food. The second thing that we need to consider, obviously, then, is the sodium to potassium balance. And if the food is out of balance, so for example, if you eat 100% unsweetened chocolate, which is not sweet, it has no sugar in it, but it's very rich in potassium. If you want to avoid the ensuing migraine from eating unsweetened chocolate, dip it in salt. You need to balance 1-to-1, because in our body, by weight, we have 1-to-1 sodium to potassium. But if you're eating food very high in potassium or very high in sodium, you're causing an imbalance. It's as simple as that.